Hi, everyone. Can you hear me there? Great. So I'm going to assume you can hear me. So I'm Marion Leary. I'm the Director of Innovation Research at the University of Pennsylvania Center for Resuscitation Science. I'm going to be talking to you today about using digital strategies to improve resuscitation outcomes. And I'm sorry I can't be with you in New Orleans today, but I will put up my avatar in the corner of the slides here so that I can at least be there with you in spirit. Here in my financial disclosure, I'd just like to mention that I do have ownership in a University of Pennsylvania startup company called Emerge Labs, and we're looking at commercializing some of the virtual reality technology that I'm going to briefly be talking about today. So over the last couple of years, both the American Heart Association and the National Academy of Medicine both put out reports looking at highlighting the need for innovative solutions to improve awareness, response, and outcomes to cardiac arrest. The National Academy of Medicine in their report had a section on emerging technologies and devices that stated emerging technologies can potentially revolutionize treatment and care for cardiac arrest. So today I'm going to be talking to you about a few innovative digital strategies. I have about 10 minutes, and that's not nearly enough time to cover the depth and breadth of this topic. So I'm going to be going through a rapid-fire, high-level overview of just a few of the innovative strategies that I think could potentially improve bystander response, training, and outcomes. So first up are mobile devices. I think everybody knows what a mobile device and mobile applications are. Mobile applications can run on our mobile devices such as smartphones, tablets, even digital cameras. So mobile applications are pretty ubiquitous these days and very plentiful. There are mobile applications that run the spectrum for everyone from those affected by cardiac arrest, including patients and families, even to providers. So for example, this application on the right-hand side there by the American Heart Association can be used during resuscitation events to assist with algorithms, timing, treatment, and care. There are also mobile applications from the American Red Cross and others that can assist with CPR training and also education around the entire resuscitation event. There's also CPR timers and CPR helpers for, again, training, simulation, and education. Additionally, there are mobile devices that have combined with mobile applications that can assist with CPR quality and can give you a scorecard of your rate and your depth. If you see here the picture A and B, we have a mobile application that's paired with either a smartphone device or a smartwatch device, and then you get a readout of your CPR quality, so your compression rate and depth, all with the goal of improving CPR quality right there in simulated training. There are also other applications on mobile devices like this one from Good Sam that allow call centers to have audiovisual access to the scene of an out-of-hospital cardiac arrest event, allowing a live stream of what is going on in the field prior to EMS arrival to allow for better resource management and faster care. And this is paired into the call center by the bystander who initiated 911. Also from the folks at Good Sam is the crowdsourcing mobile phone-based application that alerts trained volunteers of nearby cardiac arrest events along with locations of AEDs. This is very similar to the good work that PulsePoint is doing with connecting willing bystanders with 911 call centers to also notify them of nearby cardiac arrests. I'm not going to go too into great detail here as Richard Price will be speaking about PulsePoint shortly, but I would like to say that studies have shown that these types of crowdsourcing CPR applications work to significantly increase both rates of bystander-initiated CPR and then also survival. So this study here used a text message-based system and found a survival increase when at least one crowdsourced responder responded compared to none. So these are really important mobile applications that can crowdsource willing bystanders to perform CPR. Additionally, other applications for mobile devices include the use of virtual reality. So virtual reality is a computer programmed or live action 360 video-based system that works with your mobile phone and is paired with a low-cost virtual reality viewer. In virtual reality, you are fully immersed in the virtual environment, which can then in turn heighten stress and realism to prepare people not just with the skills to perform CPR, but to also emotionally and mentally prepare them to respond. In addition, these mobile virtual reality viewers can be easily disseminated to communities that do not generally have access to both CPR training and immersive virtual reality systems. Another example of this is the mobile virtual reality application from the Lacey Fire Department. They created a highly immersive VR CPR awareness video where the viewer is in the ambulance with EMS on the way to a cardiac arrest event, and then the viewer is in the home with the family witnessing the cardiac arrest scene in first person. It is a really, really powerful awareness video and one that I highly recommend everybody checking out. Similarly, the Resuscitation Council in the UK created a live action CPR training using the mobile virtual reality viewer. This training was designed as a choose your own adventure experience where it is literally up to you to choose to save a life. Somebody has a cardiac arrest, they collapse in front of you, and you have to choose to run to Harry or check for danger or do nothing. And if you do nothing, in 10 minutes, that person will die. Again, really powerful, fully immersive CPR training education using mobile devices. All right, so next up in my rapid fire talk, I'd like to switch to wearables. Wearables include anything from glasses to clothing, contact lenses, watches, etc. And so from one such wearable company called Sensoria, we have what we're calling smart clothing, which can detect lethal arrhythmias and send a notification to a designated emergency contact. So Sensoria has both t-shirts and sports bras that they are advertising for athletes so that they can be monitored while they are out doing their sports activities. Similarly, the iBeat smartwatch claims to monitor your heart rate 24/7 and will notify family of a 911 emergency. All of these types of products have the goal of getting help to somebody who has a cardiac arrest faster. And these things work. So in October, this gentleman on the left here noticed his heart rate had increased significantly. You can see it in the right upper hand corner of that tweet there. He went to the ER and found out that he had a pulmonary embolism, and he noticed it because of his device. So that little watch on his wrist saved his life. Just this past week, Apple announced it was going to partner with Stanford University on a new study to track irregular heart rhythms via their Google Watch. So more to come from that. Another wearable is the Google Glass, which is a device that you wear like a pair of glasses and has a little glass cube near the eye where you can see a holographic image. It also has telemedical capabilities as well and video and photo capabilities. So this group here used it in a simulated cardiac arrest event where they had a physician giving telemedical support and found that using this device with the telemedical support statistically increased successful defibrillation and CPR times. And Google Glass is not the only wearable on the market. Oakley has a pair as well, as does the social media platform Snapchat. So you can record a video and then the video gets uploaded to your Snapchat account. Finally, though not digital strategy per se, I'd like to mention two technologies that I believe can really enhance EMS systems and out-of-hospital care and hopefully overall survival. So the big one to me is AED drones, and there are many groups examining drones for AED delivery, and these are starting to be tested. So one group performed a retrospective study of out-of-hospital cardiac arrest locations and EMS response and found that using EMS stations as drone facilities reached 80% of cardiac arrests within one minute. Additionally, another group used drones to examine AED delivery time from out-of-hospital cardiac arrest via a GIS simulated model and found that in all drones arrived before EMS 32% of the time, but in rural cases, the drone arrived before EMS in 93% of the cases, and more importantly, saved 19 minutes. So a really good way of increasing AED arrival time to increase the use of these technologies when minutes count. And then finally, one other big area right now is the use of voice activation. And this is where, especially for cardiac arrest, where most cases happen in the home, these types of devices could potentially play a big role. You can now ask your Alexa to tell you how to perform CPR. So obviously there's a lot more research that needs to be done in all of these areas with these new digital strategies and technologies. But these are just a few that I think will make a big difference for cardiac arrest care and survival in the future. So with that, I'll just thank you for having me and look forward to the rest of the session.